I remember Dr. Evans talking about she wanted to be remembered as a woman who cared. And I feel like that definitely was infused in Dr. Maris and in Dr. Mosse, but I feel like her mentorship gave him this unbelievable ability to not only look at what treatment would be best for Elijah, but to look at our whole family and what was best for our whole family, and to genuinely care about him and about his quality of life and about his future and his development and his happiness.
When our son Philip was 3 years old, he went in for a routine tonsillectomy. When the surgeon went in to remove the tonsils, she found that there was a tumor behind the right tonsil that was pushing the tonsil out and making it look enlarged. The doctors had told us that Philip would not survive, he would not see adulthood. Our oncologist asked us if we would be willing to come to Philadelphia.
The biggest thing I noticed when we come to CHOP and the whole team and Dr. Mosse is she wasn't only concerned about Philip. She was concerned about Wendy, she was concerned about myself.
When we came to Philadelphia to meet with him for the first time, we were of the mindset that our son was going to die very soon. And the level of care that he showed for us and for Elijah, and the way that he spoke to Elijah specifically, I feel like the two of them formed a bond like almost immediately. And it was very evident to us that Elijah's best interest was always going to be at the forefront of Dr. Maris's mind with anything that he did.
When a child is diagnosed with cancer, it doesn't just affect the child, it affects the entire family. Everybody now is diagnosed with cancer. I've seen families that uprooted their lives to move to Philadelphia just to get treatment from Dr. Mosse and Dr. Maris. They provide amazing family-centered care that I have ever seen.
Doctors Yael Mosse and John Maris are physician scientists who lead a combined translational neuroblastoma program. And the research in the program is truly innovative and groundbreaking, focusing on scientific discoveries, saving children's lives, and improving the lives of children who face neuroblastoma, and especially the patients with a high-risk form of the disease for whom cure rates still remain dismal.
Just they're unrelentless in terms of their dedication to families and children, and really trying to make neuroblastoma a chronic disease often, and just keeping these kids happy and healthy as long as they can.
Much of the focus in the lab is to identify less toxic, more precise, more targeted treatment modalities that are tailored to the specific genetics, specific characteristics of a patient's tumor. The lab also works on potential cures, exciting new treatments that can utilize the body's own immune system to fight this cancer.
I like that precision medicine and how we could bring that to the children so that we could reduce those off-target toxicities of drugs. And seeing kids here at camp that have benefited from that precision medicine has provided me this fulfillment to continue that.
I see how important this work is to the lab staff, and the way that comes through to me is I see them in the clinical setting sometimes. They're very interested in knowing what the impact of what they're doing in the lab. Those stories are very important to them, and they work so hard to bring all of that lab work to the clinic.
There were lots of sleepless nights, thinking, because the whole trial was completely different than what Philip had experienced. I mean, his hair grew back and he was eating a lot, and you would never know that he was getting treatment. Nobody knew if it would work, but we took a chance. He's alive, and Dr. Mosse is our miracle worker.
I think she does a great job of meeting the patients where they are, understanding their journey, and helping them to move forward. She does a great job at providing patients with options.
I think John's just a great guy. He's, again, been my mentor ever since I've been at CHOP and Penn. And he says, well, I'll always be here, and I consider mentoring a lifelong endeavor, and it's something I've tried to carry on to my own mentees.
CHOP offers the most advanced treatments available anywhere worldwide. And the Maris Mose program is truly a global leader in the field of precision medicine. And their work is also presented on a pretty major conference. It's called Advances in Neuroblastoma. And this conference was actually started initially by Dr. Audrey Evans here at CHOP in a smaller conference room. And now this conference is attended by hundreds of top scientists worldwide.
The research that Dr. Maris and Dr. Mosse have done, it gave us a lot more time with Elijah than we would have had otherwise.
Because of what they've done, both of them, we were able to see Elijah become a talented musician and a wonderful young man and know what kind of adult he was going to be. And it's a gift we'll never be able to repay or thank them enough for or adequately express our gratitude.
Thank you, Dr. Mosse, for giving us our life and giving us our son.
Thank you, Dr. Mosse, for always caring and reaching out and being there for us when we needed you.
Thank you, Dr. Mosse.